Hi, folks. I'm Chris Coraggio. Joining us today is Dr. Alex Afshar with the Vein Institute. Doctor, thank you so much.
Thanks for having me.
You got it. You got it. The topic today is the treatment of vein disease and how it's evolved over the years. Talk about some advancements in your field.
There has been quite a lot of advancements, pretty dramatic actually. Prior to 2002 or so, we used to strip veins. Patients used to be admitted into the hospital. They needed general anesthesia, veins were stripped, some needed blood transfusion afterwards, a lot of recovery, a lot of pain and discomfort.
So it was a big procedure back then, right?
It was, and nowadays we call it a barbaric procedure, yeah.
How many people had that procedure, or just did they deal with their symptoms on their own?
We used to minimize the number of people that we wanted to do the procedures on because the procedure was so the recovery was so harsh. So we used to ask patients to just wear stockings, elevate their legs, just deal with their symptoms if it didn't cause any disruption to their daily activities.
Okay, so now if you have vein disease, what's the treatment?
Now you come in as you are, we close the vein that's incompetent and causing the issues with some sort of thermal closure. We can be called radiofrequency ablation, laser ablation, chemical ablation, and you're back to work right off the table.
So no stripping?
No stripping anymore.
So you said they can get back to work the same day?
Oh, right off the table. Absolutely.
Really?
Absolutely.
Wow. And who usually develops vein disease? Well, what age groups are we talking about?
Well, majority of about 70% of the patients that develop vein disease are female. The rest are male. The most common cause is genetics. The second most common cause is 2 or more pregnancies. Then down the list is trauma, obesity, diabetes, so forth and so on.
And the good news is the treatment is very successful. Successful outcomes, I would imagine, right?
Well, nowadays the success of the treatment is in the upper limits of 98%.
Can't do much better than that, doctor.
Thanks
Great
for
stuff.
having me.
We appreciate it. And folks, we'll see you next time.